With Dr. John Stewart with LSU LCMC, and he just recently moved to the area. So could you tell us a little bit about where you work and what type of doctor you are and what you all offer here?
Sure. So thank you for the opportunity. I am a surgical oncologist by training, and I am the Cancer Center Director for the LSU LCMC Cancer Center.
And how long have you been in this line of work?
So I've been in practice in surgical oncology since 2004. It's amazing how fast 18 years go by.
Yes. And you're also opening up a practice as well at the end of September?
Yes, and so I will have a practice that consists of managing patients who have breast cancer and advanced melanoma.
Well, Unite is very grateful for the support and sponsorship of LSU LCMC. And you all have been a sponsor for a few years now, and we're so excited to have you on board. So first of all, thank you for that.
You're welcome.
And we know there's been some changes going on with LSU LCMC, and you all are working on a special designation with the National Cancer Institute. Can you tell us a little bit about that designation and what that means for the residents of Louisiana?
Sure. So unfortunately, the incidence and outcomes for cancer in Louisiana are far behind that of the rest of the United States. Some of that is reflected on the fact that we have a highly rural population. Some of it is related to the fact that we have exposures that cause cancers. And so I think that it is important for us to conduct research that is informed by the community to improve cancer incidence and cancer outcomes. And so the National Cancer Institute has a designation that is primarily a research designation that seeks to understand how we are applying benchtop research to meet the needs of the community. Another important aspect of that designation is that we are employing and devising programs that actually control the determinants of cancer. And finally, the opportunity to have our patients be involved in unique clinical trials for cancer so that they don't have to travel for those trials is also a hallmark of our cancer center that we believe will lead to NCI designation.
And with that designation, you work on survivorship, right, and meeting the needs of cancer patients through that aspect as well?
Yes, and so I think of survivorship as a very important part of cancer care. And so we think about screening, diagnosis, treatment, and survivorship. Now, fortunately, we have a lot more survivors of cancer than we did even a decade ago based on the advent of novel therapeutic approaches to cancer. And so understanding how we improve the lives of patients who have survived cancer is a very, very, very important aspect of what it is that we will do in the future. Now, I will tell you that all of the answers for survivorship are not there, right? I mean, we still have to have active research around survivorship in order to make that post-treatment course of life that much better.
One of the things about Unite that we love so much is and Dr. Stewart hasn't had a chance to see a Unite any of the functions that we've had, but you'll see it soon. And one of the things that we love is we have people who are survivors, and we also have fighters, people who are currently going through cancer treatment, maybe even just newly diagnosed. So why do you think it's important to have a program such as Unite, and why do you think it's important to be a sponsor of something like that for the women and even the caregivers in our community?
And so cancer exacts a tremendous toll on patients and their caregivers. I mean, it's a difficult time understanding the complex medical system that we have and some of the complex treatments. And so having the opportunity to just kind of go out and enjoy other people who have had similar walks, I think is extremely important. And more importantly, it also plants a seed of hope. You know, we know that hope is an important part of cancer treatment. Hope is an important part of survivorship. And so finding your tribe at events such as Unite is very important. And I think that as LCMC is a sponsor or the sponsor of Goodnight. It speaks to our dedication and our understanding of the importance of survivorship.
And you've mentioned you've touched on a lot of aspects of caring for cancer patients and in your line of work. How do you help ease patients' feeling of being anxious? You know, it's a very scary time when you hear that word and all the uncertainty and all these medical terminology is thrown at you. How do you help patients feel a sense of ease about everything?
So as I mentioned before, hope is very important.
Right.
Okay? And so we should never, as physicians or any caregiver, diminish that hope that a patient has. And so, you know, there are a couple of things that I move forward or take with me in my practice. Number one is that you always have to be truthful.
Right.
And upfront. Okay. And so you have to be truthful with the prognosis. But while you're truthful with the prognosis, you also relate to the patient what the outcomes typically are for treatment, what to expect along the way. And more importantly, patients have to understand that you're in this with them. Right? That you're in this with them. And so, you know, it's difficult to be a doctor who sees a patient on Monday and they might not see him again for 2 weeks and they hide in a hole. That's not the way that medicine should be practiced. And making sure that we have systems that allow for access for our patients is extremely important.
Well, speaking of these systems, and you've touched on this as well, what sort of advancements have you seen, or where do you think we need to work on improvement in terms of medical care, whether it's, you know, getting good insurance or just the cost of medicine? You know, cancer is expensive. So have you seen any improvements since you've been in practice, or what are you hopeful for?
So I'll touch on 3 important things that have happened in my practice, and I started training 28 years ago. Excuse me, 27 years ago. So there are 3 important things. So the first is the continued explosion in the field of cancer immunotherapy. So I spent 4 years at the National Cancer Institute understanding how your immune system can fight cancer. Okay. And studying drugs that modulate that response. Now we've come to the fact that we are seeing tremendous applications across the field for a variety of cancers using immunotherapy. That's number one. Number 2 is that of precision medicine. So precision medicine is understanding what mutations a tumor has that will allow that tumor to be treated by a specific chemotherapy. We know that cancer is not most readily, the biology of cancer is not most readily determined by the location of that cancer, but by many of the mutations and cellular physiology that happens within that tumor, and applying therapeutics that directly impact those mutations and those different cell signaling pathways will have allowed us to really move forward with the treatment of cancer. And the third is that of genetic testing. Okay. Although the vast majority of cancers are not determined by a genetic predisposition, it's important for us to understand which patients are at higher risk so that we can have smart screening and other interventions. You know? And so I think that there are 2 components of that. Number 1 is the test itself, but number 2 is having that conversation among family members about who's had cancer, who hasn't had cancer. Candace Henley, who is a good friend and the CEO of the Blue Hat Foundation, who is a colon cancer survivor, typically says that family secrets kill families. And so we have to have conversations around that and employ our genetic surveillance opportunities that we have.
I know you always see when you fill out the paperwork at the doctor's office, it's history of cancer in the family. Mm-hmm. Got to check those boxes, right?
Yes.
So what led you to become a doctor? Was there a specific experience as a child, or did you always want to be a doctor? And more specifically in the field of oncology, of cancer?
Sure. So, there wasn't a specific incident that happened that I wanted to be a doctor. I mean, when I was a kid, I guess I got constant C's in handwriting, so that let me know that I was
perfect to write those prescriptions?
Yeah, yes. So perfect C's in handwriting.
Right.
So it was destined for me to be a physician. But as I progressed through school and went to college, I really fell in love with science, particularly biology. And then had the good fortune of making the decision to go to Washington, D.C. for medical school at Howard University. And there I was exposed to a number of outstanding physicians, But one of the people that comes to mind is a gentleman by the name of Dr. LaSalle de la Fall, who is one of the preeminent cancer surgeons in the country. And so seeing how he managed cancer in his patients who would come from far and wide. I remember most specifically about a young woman who had gastric cancer from St. Louis, who was being treated, went to Washington, D.C. to get her operation for cancer. And so I went to residency and then had the opportunity to spend time doing basic research. And so the biology of cancer, the immunobiology, really fascinated me, right? And that really shaped the way that I think about treating patients and approaching clinical trials and standard care for those patients.
Well, we know that you just moved back to Louisiana. You're a Louisiana boy to begin with, and now after several pit stops along the way, you're back.
Yes.
So what's it like to be back in Louisiana? A little bit hot and humid down here?
Yes. Who doesn't love a warm, wet wind, though?
Right. I mean, and the mosquitoes, we got it all.
Right. So, yes, but the food is great.
The food is great.
And the people are great.
I agree with you. Well, we are so lucky to have you back in Louisiana and here at LSU LCMC. And again, we thank you so much for your support.
Thank you.
And we hope to see you at all the Unite events. I think you and your wife will love it. And you have a wife, and how many children do you have?
So we have 3 little ones. Not little ones. But they're in college now.
Right.
Yes.
They'll always be little, right?
Yes. As I explained to my dad a couple of weeks ago, Dad, I'm not 12.
I'm a doctor now.
I'm not 12.
Right. Well, thank you so much for your sponsorship of Unite, and the people of Louisiana are awfully lucky to have a great doctor like you here to help us with all of the issues with cancer and the patient care. So we thank you so much for being here.
Thank you.